We are welcoming Eric Kaufman, who is with the Department of Aging. So the HIICAP program, where they have volunteer counselors that help people with questions about Medicare and other insurance questions. And so he's going to be talking to us today a little bit about that.
So today I want to talk about basically four topics in Medicare. I wanted to talk to you about enrollment in Medicare, cost in Medicare. This is what you're responsible to pay for as a person with Medicare or Medicare beneficiary. Programs that some people qualify for that may help with these costs. And then most important this time of year, especially, choices in how you get your Medicare coverage. Medicare is a federal health insurance program. Mostly it's for people that are age 65 and over. And whenever I meet anybody that's turning 65, and I do that all the time nowadays, my first question to them will always be, are you collecting Social Security? Because I know if somebody's collecting Social Security prior to their 65th birthday, they're going to be automatically enrolled in both Part A and Part B of Medicare. And some of you may remember that at one time, the full retirement age for Social Security was 65 and Medicare was 65. And in those days, most everybody was automatically enrolled in Medicare. It was much simpler back then. But today, the full retirement age for Social Security, it's working its way up to age 67. More people today are deciding to collect Social Security after 65. If that's your situation, you will not be automatically enrolled in Medicare. And it'll be up to you to enroll in Medicare Part B during one of the Part B enrollment periods. The first enrollment period is called the initial enrollment period. This is when people are first eligible for Medicare. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65. So that means the 3 months prior to the month you turn 65, the month you turn 65, the 3 months after that. If you enroll in Medicare Part B in any of the 3 months prior to the month you turn 65, Part B will start the first of the month you turn 65. If you enroll the month you turn 65, Part B will start the first of the following month. And if you enroll in those last 3 months after the month you turn 65, Part B will still start the first of the next month. Now, some people, when they turn 65, they are still working or covered under a spouse, not a domestic partner, but a spouse that they're married to at 65 who's still working. And especially if they're working for a large employer where the employer insurance may be their primary, their main insurance, they may want to delay enrollment in Medicare Part B at 65. Why? To save the monthly premium. If that's your situation and you are covered again under your own or your spouse's active current employment, not retiree plan, not COBRA, but active current employment starting the month you turn 65, you can delay Part B and then sign up later using what they call the special enrollment period. The special enrollment period allows you to pick up Part B while you're working or within 8 full months following the month you're no longer covered through active employment. So if come 65, let's say you're still covered under your spouse who's working for the city of New York, you may want to delay Part B. And then a couple of years later, when your spouse is ready to retire, sign up for Part B then using the special enrollment period. And that's very common for people that are still working or covered under a spouse who's still working when they turn 65. Now, for the people that don't sign up during their initial enrollment period, who don't qualify or maybe miss the special enrollment period and then realize later they need Part B, they make them wait till an annual period to sign up. It's called the general enrollment period. It's every year, January through March. If you sign up during that time, Part B starts the first of the next month, but you may be subject to a penalty. The penalty for late enrollment in Part B, it's 10% of that year's standard premium for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty, it's not a one-time penalty. You pay that for the rest of your life. So I just want to stress to everybody that the only people that can delay enrollment in Part B at 65 and sign up later without having to wait till the next general enrollment period and without being subject to the penalty are the people that are covered at 65 under their own or their spouse's active current employment. Now, when you finally do enroll in Medicare, they'll send you this red, white, and blue Medicare card in the mail, and that shows you the two parts of Medicare. Part A is your hospital insurance, covers you if you ever need to be admitted to the hospital. Part B is your medical insurance, covers you mostly for doctor services. So if you're Medicare eligible prior to age 65 due to disability, what happens is you're eligible for Medicare after collecting Social Security disability for 24 months. At the end of that 24-month period, because you're collecting a Social Security benefit, you are automatically enrolled in Part A and Part B of Medicare. It is not necessary for you to enroll. When you turn 65, your Part A and Part B will just continue. You don't need to re-enroll at 65. In this section, we'll talk about cost of Medicare, what you're responsible to pay for under Medicare Part B medical insurance, Medicare Part A hospital insurance, and Medicare Part D, which is the prescription drug coverage. So let's start with the Part B premium. Now, most people get Part A hospital insurance for free. As long as you worked, you paid into Medicare for at least 40 quarters, 10 years, or you had a spouse, maybe even an ex-spouse that did, Medicare Part A is free. But Medicare Part B, people pay for that. The standard Part B premium you see is $164.90 per month. But you could also see from the slide that some people pay a higher premium because they have a higher income. And for this year, we're talking about people's incomes are above $97,000 for a single, $194,000 for married couple. What they're looking at in terms of income is what they call your modified adjusted gross income. So that's your adjusted gross income, plus if you have tax-exempt interest income, those two lines in your tax return added together define your modified adjusted gross income. And they're looking at that from 2 years prior. So for 2023, currently, they're basing your premium on your 2021 tax return. And if your income from that year was above the threshold, today you're paying a higher Part B premium as a result. And then for 2024, they're going to look at your 2022 tax return. Okay? And if your income is above the threshold, whatever the threshold might be next year, you'll get a notice from Social Security at the end of the year what your 2024 premium will be based on your 2022 tax return. And then you'll see in the third column here, for people that pay a higher Part B premium based on their income, if they also have a Part D drug plan, which we'll talk about coming up, they pay an additional surcharge for their Part D drug coverage as well. It's paid in the same way as your Part B premium. If you're collecting Social Security, it's taken out of your check. If not, it's billed to you directly. Now, besides a monthly premium for Part B, there's an annual deductible. This year, it's $226. So that means the first $226 in covered medical expenses, that's your responsibility unless you have other insurance to pay it for you. Once you meet the deductible, Medicare generally pays 80% of what they allow, and you're responsible for the other 20%. That's the Medicare coinsurance. It's different though for lab tests and for most of the preventive services, things like screening mammography, the flu vaccine. Those are all covered 100% by Medicare. But most everything, whether it's an office visit or mental health or physical therapy or surgery or anesthesia or radiology, they're all paid by Medicare at 80% of what they allow once you have met the annual Part B deductible. But in order to really understand your responsibility under Part B, you need to understand about the concept of assignment. Here's a really important term for Medicare. So what does it mean when a doctor accepts Medicare's assignment on a claim? If your doctor agrees to accept assignment, that means that he or she agrees to accept whatever Medicare allows as payment in full. And then what do you pay? Any unmet portion of that annual deductible plus the 20% coinsurance. That's assignment. Now, if your doctor signs a participation agreement with Medicare, as most doctors have in the United States, if they're participating, that means they always accept assignment on all claims for all people with Medicare. They never bill above what Medicare allows for any of their services. But if your doctor doesn't sign that participation agreement, if they're non-participating, they can still be part of Medicare, but they actually have a choice on each and every claim to accept assignment or not. If you ever see one of those non-participating doctors and they decide not to accept assignment on your claim, not only are you responsible for the annual deductible and the 20% coinsurance, but they can also bill up all Medicare Part B providers, including doctors throughout the United States. They need to fall into one of these three categories. They can either be participating in Medicare, in which case they always accept assignment, never bill above what Medicare allows, and your responsibility then is only the annual deductible plus the 20% coinsurance. Or they could be non-participating but still part of Medicare, in which case they have a choice on your claim to accept assignment or not. If they don't accept assignment, besides that deductible and 20%, they can bill up to a limiting charge at most 15% above what Medicare allows. Or the doctor doctor can opt out of Medicare, in which case Medicare will pay nothing at all for their services, and you would be responsible for up to their usual fee. All Part B providers, including doctors throughout the United States, need to fall into one of these three categories. Now, that's how it works for Medicare Part B medical insurance. For Medicare Part A hospital insurance, it's very different. Although most everybody gets Part A for free, for no premium, there's a large deductible if you need to be admitted to the hospital. This year, for a hospital admission of up to 60 days, Medicare will pay everything but the deductible. It's $1,600. If you're in the hospital beyond 60 days, for the 61st through the 90th day in the hospital, you're responsible for a daily copayment. This year, it's $400 per day for those additional 30 hospital days. If you're in the hospital beyond 90 days, Medicare allows an additional 60, what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage in any combination. But once you've used them, that's it. They're non-renewable. For those 60 lifetime reserve days, you're responsible for a daily copayment this year, $800 per day. If you're discharged from the hospital to a skilled nursing facility for rehab care, Medicare will pay the first 20 days there in full, but the next 80 days you're responsible for a daily copayment this year. That is $200 for days 21 through 100 in the skilled nursing facility. And these Part A benefits, they're not a calendar year benefit like Medicare Part B. Part B is fairly simple. You know, you got one deductible, $226 this year. Once you've met it, that's it. You're done for the year. But the Part A deductible, somebody may have to meet that more than once in the same calendar year, because it's once per what they call a benefit period. And the key to understanding Part A is to know how the benefit periods run. A benefit period begins the very first day you're admitted to the hospital, and it ends when you've been out of the hospital, out of the skilled nursing facility for a period of at least 60 consecutive days, at which point your benefits renew. They start again. So let's say, for example, you had to be admitted to the hospital tomorrow for 5 days. Medicare will pay everything but that deductible, $1,600. But what if next month you need to be readmitted to the hospital or a different hospital? Same condition, different condition, doesn't matter. Less than 60 days have gone by since you were discharged. You're still in the same benefit period. You'll just pick up where you left off at day number 6 of your first 60 days of coverage. You don't have to meet a new deductible. Let's say instead of being readmitted in November, what if you're readmitted a couple of months later? You know, if it's more than 60 days from when you were discharged, your benefits renew. They start again. You're back to day number 1 of your first 60 days of coverage, and you're responsible for a new deductible. So I hope this slide will help to point out the importance of people having other insurance besides Medicare. Because for people that have Medicare only, like some people do, you could see they could wind up paying a lot out of pocket, especially for hospitalization. And when I talk later about privately purchased Medigap plans, you'll see how that fills in very nicely here. And that's a big reason why someone would purchase that additional insurance. And then there are some services Medicare just doesn't pay for at all. These are the more common services, including dental care. Medicare does not cover a routine vision exam or eyeglasses. One exception, they'll pay for one pair following cataract surgery. Otherwise, they don't cover eyeglasses. They don't cover hearing aids. And very important, Medicare doesn't cover long-term care. Medicare covers what you saw on the last slide, short-term rehab care in a skilled nursing facility. And Medicare does not cover a routine annual physical exam. You may have seen in the Medicare handbook where they cover what they call an annual wellness visit for all people with Part B, but that's not a comprehensive physical. A comprehensive annual head-to-toe physical exam has never been covered under original traditional Medicare. And if that's the service you have, it would be out of your pocket. Also, Medicare does not cover services outside of the United States and its territories, like Puerto Rico or the U.S. Virgin Islands. So if you're traveling through Europe, Asia, Africa, even across Canada or Mexico, even in the event of an emergency, Medicare will not pay for those services at all. Not at all. So far today, I'm talking about one way that people get their Medicare, original, traditional Medicare. Part A hospital, Part B medical, and the cost in Medicare. Now, for those people that choose original traditional Medicare and who want drug coverage through Medicare, they can purchase a separate standalone Part D plan. This year in New York State, we have 19 of these plans. Next year, we're going to have 15. Those plans, though, have their own formulary, their own list of covered drugs. Plus, they have their own network of participating pharmacies. So how do you know if the plan covers all your drugs and is accepted at your pharmacy? You should go to the Medicare website, medicare.gov. They have this plan finder search tool where if you enter the names of your drugs, not just the names, but the dosage, the strength, the quantity, and then select your pharmacy, that search tool will compare all the plans and rank them based on your individual needs from least expensive to most expensive. And then realistically, you probably only consider the first 3 or 4 plans. That's the way to make a good decision. If you're not comfortable using the website, you can call Medicare. 1-800-Medicare. They're open 24/7. If you want local assistance, that's us at the HIICAP program. We're all going to the same website to make the same comparison. So the information is available now for 2024. And if you find there's a better plan for you for next year, the time to sign up is during the annual election period, October 15th to December 7th. If you do, your plan starts January 1. And what do these plans cost? Well, the average plan premium is probably about $40, $50 a month, but it varies. In addition, plans can have a deductible. Next year, that could be as high as $545. Some plans have a $545 deductible for next year. Many do. Some have a lesser deductible. Some have zero deductible. Once you meet the deductible, if any, you're subject to a copayment for a fixed dollar amount that you pay for drugs until you get to what they call the coverage gap, the donut hole. That will begin at the point next year that you get to $5,030 in total drug costs. Regardless of what you paid out of pocket up to that point, doesn't matter. When the total cost of your drugs gets to $5,030, now you're in the coverage gap in 2024. And at that point, you'll pay 25% of the cost of the drugs out of pocket until, for some people, they reach what they call catastrophic coverage. Catastrophic coverage next year will begin at the point that you get to $8,000 in what they call TROOP, is the acronym, TROOP, true out-of-pocket cost. So what does that $8,000 include? Everything you pay. Not the monthly premium, but everything you pay at the pharmacy. Deductible, copay, co-insurance, the 25% during the gap. And one thing you don't pay, luckily still counts towards that $8,000. And that is for brand name drugs that you're getting during the coverage gap. You're paying 25%, but what you don't see of the other 75%, 70% of that, most of that cost is a drug manufacturer rebate. Even though you don't pay it, still counts towards that $8,000. And that's good for you because that gets you out of the coverage gap and to the catastrophic coverage for many people next year without having to pay nearly $8,000 out of their pocket. And once you get to the catastrophic coverage, you'll see your drug costs go down. And I'll talk about that coming up on the next slide. Before I do that, I want to tell you about some things that changed with Part D at the beginning of this year. First is how Part D covers vaccines. Now, some vaccines like the flu vaccine, the pneumonia vaccine, those are covered under your Medicare Part B medical insurance. And they're covered 100%. But other vaccines like the shingles vaccine, which people ask about all the time, it's not covered under Part B. It's covered under Part D. And if you had the shingles vaccine prior to this year, although it could have been covered, you might have paid a lot out of pocket. But if you have the shingles vaccine covered by your Part D plan today, it's now covered 100%. The other change for this year was how Part D covered insulin. Part D plans cover insulin on their formulary. But if you had that last year, you might have paid high out-of-pocket costs. But this year, insulin is limited under your Part D plan to no more than $35 a month, and it's not subject to any deductible. And then for people that reach the catastrophic coverage this year, they have to pay 5% of the cost of the drugs out of pocket. But starting next year, anybody that reaches the catastrophic coverage, no more 5%. It's going to be covered 100%. And the biggest change to Part D will happen not next year, but the year after, 2025. For the first time, we're going to have an out-of-pocket limit. So today, there is no out-of-pocket limit. There is no limit on what you can pay for Part D covered drugs. But starting in 2025, it's going to be capped at $2,000. And then that number could be adjusted upward each year. And not only that, that $2,000, you don't even have to pay it all at one time. You're even able to spread out the payments over the course of the year. So that is a big, big change coming to Part D. And that'll be especially helpful for people with very high drug costs. beginning in 2025. So in this next section, since we talked about cost in Medicare, I want to talk about programs that some people qualify for that help with those costs. The first one is called Extra Help, or the Low Income Subsidy. This is a subsidy the government provides to help people with their Medicare Part D drug costs. Some people get this automatically. If you have both Medicare and Medicaid, or you're on one of the Medicare savings programs where the state pays your Part B premium, it's not taken out of your Social Security check anymore, automatically you get full extra help, which means you'll get a subsidy that can pay your entire Part D plan premiums. You get a Part D plan for zero premium, and reduce your copayments to only small copayments at the pharmacy. If you're not on Medicaid and you're not on a Medicare savings program, but you have limited income and limited resources, you won't get this assistance automatically, but you may be able to apply. If not for full extra help, at least for the partial subsidy. But next year, they're going to improve on the partial extra help. The people that have partial extra help currently will be automatically moved to the larger full extra help benefit beginning in 2024, where they will get a much larger subsidy for their premium and lower cost sharing for their Part D covered drugs. And then EPIC is for us in New Yorkers who are 65 and over that have incomes of up to $75,000 per year for a single, $100,000 for a married couple. EPIC does not work on its own though. EPIC only works as a supplement to your Part D drug plan, and it works with every Part D plan. Where Part D is your primary, your main insurance, EPIC wraps around. EPIC helps to fill in the gaps in Part D. But there's one gap that EPIC will not help with, and that is your Part D plan deductible, which we said could be up to $545 next year. EPIC's not paying that. But once you meet the deductible, EPIC can help lower your copayments. EPIC can help you, especially during that coverage gap. And for most people, EPIC is a free program. So to give you an idea, if you're a single person and you had an income from last year between 20 and 75,000, like many people in New York did, you would be in EPIC's deductible plan. You don't have to pay anything for EPIC, but you'll have to meet a deductible on a sliding scale based on your income before EPIC will help pay for your drugs. Sometimes people say to me, I don't use a lot of drugs. How am I ever going to reach this deductible? It's $1,000. It's $2,000. But I would say, so what? You don't reach the deductible. It's free coverage. In the meantime, you have EPIC in place should your situation change. And let me tell you another benefit of EPIC. Unlike most people who can only change their plan, their Medicare plan, during that annual period coming up, EPIC members can change their plan one additional time each year outside of the enrollment period. So we help people to apply for EPIC, besides helping them with their drug costs, just to be able to change plans without having to wait till the next year. And if you're not an EPIC member already, you can sign up anytime. You cannot apply online, but you can download the application, fill it in online. You'll have to print it, sign it, and mail or fax it to EPIC for processing. And then lastly, and most important, the Medicare Savings Program. The Medicare Savings Program, for people that qualify and apply, the state will actually pay your Part B premium. It'll put that $164.90 back into your Social Security check. If you know somebody that has Part B and they're not paying a premium, they're already on the Medicare Savings Program. But if not, they may qualify. And in New York State, many more people qualify this year than ever before, because as you can see from this slide, they greatly increased the income limits for New Yorkers. So if you look at the bottom of the slide, last year, the income limit for a single person was $1,549, but this year it's up to $2,280. And a couple of advantages to living in New York State, besides these higher limits, one is that they don't look at assets or resources. Like the EPIC program, they don't care about money you have in the bank or investments, only income to qualify. On top of that, even if your income is too high, you might still qualify. Because if you're paying privately for health insurance, they allow you to deduct your health insurance premium from your income to be eligible. Now, they do not allow you to deduct the Part B premium, so they'll look at your gross Social Security before the premium is deducted. But other premiums you can, such as a Medigap premium. So if you're paying $200 or $300 a month for your AARP Medigap plan, but your income is $2,400, you're eligible for this program because you could subtract that from your income. Sometimes we meet people whose income's only slightly above the limit, $5, $10, $15. For that person, it'd be worth it to buy some cheap dental policy or vision policy. Ever see them advertised? $20 a month or $25 a month? Because paying that $25 a month, now you qualify for a program that pays $164.90 a month for your Part B. Plus, automatically, it gets you extra help with your Medicare Part D drug costs, where you can get a Part D plan for zero premium and reduce your copayments to only small copayments at the pharmacy. So these are the people that do best in New York State, the people that qualify and apply. And if you're a New York City resident, our counselors are all trained to do the application, and we're happy to do that with you. So earlier, I spoke about one way to get your Medicare: original, traditional, fee-for-service, straight, regular Medicare, Part A hospital, Part B medical, and about the gaps in coverage, deductibles, co-insurance. Now let's talk about filling in the gap. Most people today don't have retiree health insurance. Most people don't qualify for Medicaid. So what do? They might purchase a private Medigap, a Medicare supplement plan. Medigap plans are identified by letter. There are 10 standard plans ranging from plan letter A to plan letter N as in Nancy. All the Medigap plans cover certain things. They all cover days 61 through 90 in the hospital. Remember that $400 a day? They all pay that. They all cover the 60 lifetime reserve days, that $800 a day. Plus, if you exhaust your Part A benefit, they all cover you for an additional 365 days of inpatient care. Most Medigap plans pay the Part A deductible, the $1,600 deductible this year. Most Medigap plans pay the entire 20% Part B coinsurance. And then other benefits vary from plan to plan. But let me tell you the two most important things to know about Medigap insurance. One is that the benefits are standard, right? So different companies sell these plans and they charge different amounts. But as long as it's the same letter plan, doesn't matter what they're charging. It's exactly the same coverage. So it's well worth your while to shop around for the best deal on a Medigap plan. The other thing to know, in New York State, unlike most states, we have continuous open enrollment for Medigap insurance. So if you have Part A and Part B and you're on original Medicare, doesn't matter if you're disabled with Medicare under 65 or you're over 65, you could buy a Medigap plan anytime. They can't limit you to only enrolling when you're first eligible for Medicare or during certain times of the year. Not in New York. Not only that, if you have a Medigap plan already and you live in New York State, you could always switch, if not with the same insurance company, by going to a different insurance company. You cannot be denied Medigap insurance in New York because of your age or because of your health. However, although you could buy a plan at any time, you may be subject to a waiting period for pre-existing conditions of up to 6 months, which most but not all the insurers have. So what that means is, although they'll sell you a plan at any time, they might not cover a service related to a pre-existing medical condition for up to that first 6 months. However, again, most people we meet are able to avoid the waiting period because they've had prior credible coverage that can count towards that. And that could be most anything. It could be another Medigap plan. It could be a Medicare Advantage plan we'll talk about next, employer plan, retiree plan, a plan through the marketplace, Medicaid if that's ending, the VA for veterans. As long as there's no break in coverage or a short break of less than 63 days from when that insurance ends and the Medigap plan begins, they'll credit the time with the prior coverage towards meeting the waiting period. As a Medicare Advantage plan all year this year, but January 1st, they're going to switch to original Medicare with the Medigap plan. They don't have to worry about pre-existing conditions. They will credit the year they had the Medicare Advantage plan towards meeting that. And because most people we meet that buy a Medigap have had some sort of prior credible coverage, they wind up not being subject to their waiting period for pre-existing conditions. If you want to see a complete listing of all the Medigap insurers in New York, the plans that they offer, and their rates, you should go to the New York State Department of Financial Services. This is the website, dfs.ny.gov. They update this each month to show you, when you put in your zip code, a complete listing again of all the insurers. This way, you know you're always looking at the most current and complete information when you're making your Medigap decisions. And then this is a page from our book, which is available to you for download on the Department for the Aging website. We also have printed copies, which we can mail to people upon request. This includes the page on Medigap insurance, where we have this chart of all the Medigap plans A through N and the benefits that they offer. I want to point out something about Medigap's Plan C and Plan F. You'll notice that Plan C and Plan F are the only two that cover the Part B deductible. That's that $226 deductible that I mentioned earlier. C and F cover those, the others don't. But C and F are only available to people that became Medicare eligible prior to 2020. So if you're turning 65 or you're becoming eligible due to disability now or last year, year before, you're not eligible to buy Plan C or F. You could buy D or G, which you see is the same plan, just doesn't cover the deductible. But the most comprehensive plan, Plan F, is only available for people that became Medicare eligible prior to 2020. Now, so when I talk to somebody that's new to Medicare, I'll talk to them about Plan G, because that's the most comprehensive plan they can buy. But it's expensive. If somebody's looking for a lower cost Medigap plan, I would then talk to them about Plan N, as in Nancy. If you move from G to N, you notice there's two differences on this chart. One is that Plan N doesn't cover that Part B excess. That's for those doctors who don't accept assignment. Remember I said they could charge a little bit above what Medicare allows, at most 15%? G covers that additional up to 15%, N doesn't. But most every claim that Medicare gets nationally, the doctor accepts assignment and they can't charge that excess anyway. So that's not a big difference. The big difference instead with Plan N is for office visits. Instead of covering the entire 20% coinsurance, like Plan G and other Medigap plans, for office visits with Plan N, you have a copayment of up to $20. But because you have that copayment for office visits, that's how they're able to offer that plan at a lower premium. If you're looking, though, for the cheapest Medigap plan possible, that's the high deductible version of Plan F or Plan G. You'll notice those two plans have an asterisk next to them. That's because there's a second version of F and G, a high deductible version that covers everything the standard F or G covers. But before they pay anything, you have to meet a deductible. This year, the deductible is $2,700. So because you have to pay that first $2,700 in Medicare cost sharing, like the Part A deductible, the Part B deductible, the 20% coinsurance out of your pocket, they are able to offer that plan at a much lower premium. So talking about premiums, you'll see this is a chart from our book also that shows you the rates as of January this year, a complete listing of all the Medigap insurers, the plans that they offer, and the rates that they charge. Just as an update, I want to let you know that Empire, Blue Cross, and Blue Shield that you see here, they are no longer selling new Medigap plans. Okay? If you have a plan from Empire today, you can keep it, but new individuals are not able to purchase a plan from Empire. Also, Empire and AARP are seeking rate increases, which if approved would be effective for January 1st. But these are the current rates for Empire and for AARP today. So far today, we spoke about one way to get Medicare, original traditional Medicare, Part A hospital, Part B medical. And for those that don't have retiree health insurance and don't have Medicaid, that could come along with a privately purchased Medigap plan. This is the other way to get Medicare, to join a Medicare Advantage plan, a Medicare health plan. This is Part C of Medicare. Nobody calls it Part C, though. It's Medicare Advantage. And these are private plans that are contracted with Medicare to provide all of your benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that accept that plan. These are the companies that send you so much mail every day, right? Whether it's Aetna or Centers Plan or Elder Plan or Empire or Emblem or Fidelis or Health First or Humana or Metro Plus or United Healthcare or VNS or WellCare. Many companies offer those plans. And most everybody's eligible to join. All you need is to have Part A and Part B of Medicare, and you need to live in the service area of the plan. That's it. But unlike Medigap insurance, where if you're in original Medicare and you live in New York, you could buy a plan at any time or switch from one insurer to another at any time. For Medicare Advantage, for most people, there's only certain times of year that are able to sign up or switch. You can sign up for a Medicare Advantage plan when you're first eligible for Medicare and enrolled in Part A and Part B. If you don't, or maybe you did, but now you don't like the plan, you want to switch, most people have to wait till the annual election period. If you sign up for a plan during that time, your new plan starts January 1. If you discover at the beginning of the year that you want to make another change, There's the open enrollment period. Every year, January through March, anybody that's in a Medicare Advantage plan has one additional opportunity to either switch to another Advantage plan or to switch to original Medicare. One time, January through March, to be effective the first of the following month. After March, for most people, whatever plan they're in, if they're in a plan at all, that's what they're going to have for the rest of the year. And it's important to remember, if you join a Medicare Advantage plan, you're not giving up your Medicare benefits. These private plans have to cover whatever Medicare covers. Plus, as an incentive to join, they will cover to a limited extent some services that Medicare does not pay for. So, for instance, they typically provide limited coverage towards things like dental, towards a vision, eyeglasses, towards a hearing aid. They might pay for gym membership for you. They probably cover that routine physical that Medicare doesn't, all as an incentive to join. But what I think the biggest incentive, especially in our area, in New York City, is that plans may be available for as low as zero premium. Now, you're still going to pay that Part B premium, $164.90 or whatever you're paying for Part B. They're saying zero additional premium. Plus, they include the Part D drug coverage, some of them as low as zero premium. And that could be a very powerful incentive, I would say, for somebody that does not have retiree health insurance, that does not have Medicaid, that cannot afford or doesn't want to pay $200 or $300 or more a month for the typical Medigap plan. You might be tempted to join a zero premium Medicare Advantage plan instead. But even if the plan has no premium, that doesn't mean the plan has no cost for you. It's going to cost you on the other end when you access care, usually in the form of a copayment. So, for instance, some Medicare Advantage plans have zero copayments for primary care doctors, but they all have copayments for specialists. Some are as high as $50. If you're admitted to the hospital, most plans have a daily copayment up to a maximum number of days, $200, $300, $400 a day for the first 3 or 5 or 7 days in the hospital. If you need physical therapy, most plans have a $40 copayment per visit. So the bottom line with the Medicare Advantage plan is not 100% coverage for most services under most plans. And you're going to pay something at the end of the day when you access care, copayment or coinsurance, up to a maximum out-of-pocket for the year. All Medicare Advantage plans have a maximum out-of-pocket limit, abbreviated MOOP, M-O-O-P, not to exceed next year $8,850 in network. So if you have a plan with an $8,850 MOOP in 2024 and you're getting physical therapy at $40 a visit, those $40 copayments are going towards the $8,850. If you have a $300 daily copayment for the first 3 days in the hospital, then $900 out of your pocket is going towards the $8,850. And if you reach that limit, most people won't, but if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. $8,850 is the highest limit any plan can have next year. Some have that limit, but a lot of plans have lower limits. And that's something you may want to compare when you're looking at different Medicare Advantage plans for 2024. Something else to compare is the type of Medicare Advantage plan. In New York City, they're mostly HMO plans. With an HMO plan, unless it's an emergency, you're limited to doctors and hospitals that participate, that accept that plan. If you go outside of their network, you're going to wind up paying the cost out of pocket. But there are some HMOs, though, that offer a point of service option, HMO-POS. They have out-of-network coverage, but it's limited. You got to look at the details. So, for instance, they don't necessarily cover all types of services out of network, or maybe only up to a limited dollar amount. If you're looking for a little more flexibility still in your Medicare Advantage product, you can consider instead the PPO, Preferred Provider Organization plan. Like the HMO, they also have a network of doctors and hospitals, and if you use their providers, you pay whatever copayment the plan has. The big difference with the PPO, you can go outside of their network. The doctors and hospitals that take Medicare, not opt out of Medicare, they take Medicare, but just don't accept your plan. And you might pay more out of pocket when you do, and you might even have to pay up front and then seek reimbursement from the plan. But for that reason, the PPO allows you more choice, more flexibility than does the stricter HMO plan. So just to summarize for today, for the people that do not have retiree coverage and who do not have Medicaid, here are your two choices. It's either original Medicare with the Medigap plan, or it's a Medicare Advantage plan. It's one or the other. Now, why would you choose original Medicare with the Medigap plan? Well, you have the most choice of providers across the country. You can go to any hospital, they all take Medicare, as do most doctors. And depending on the Medigap plan, It could be pretty complete coverage between the two. What's the downside though? High premium for the Medigap plan, plus doesn't cover your drugs. So you need to buy a separate Part D plan for another premium. So you see the people on the left here? They're paying 3 premiums every month. One for Part B, they're going to pay anyway. A second for the Medigap, a third for the Part D drug plan. So they're paying the most in premiums, but in exchange, the most choice of providers, the most complete coverage. So what about the other choice instead, Medicare Advantage? Why would you do that? Well, with the Medicare Advantage plan, you save on those premiums. You don't need the Medigap. You don't need a separate Part D. Plus, besides saving on those premiums, you get some extra benefits that Medicare doesn't cover, like dental and vision and gym membership. What's the downside? If it's an HMO, especially, unless it's an emergency, you're limited to doctors and hospitals that participate. Even if you don't pay a premium, we said we pay on the other end when you access care for most services under most plans, and sometimes a deductible, but more often a copayment or co-insurance up to a maximum out of pocket for the year. Plus, this is managed care. So they cover your mental health and your physical therapy and your planned surgery, but you may need to get pre-approval, prior authorization before that service will be covered. So for some people, it makes more sense to have original Medicare with the Medigap plan. Other people do very well with Medicare Advantage, and that's the choice for all people with Medicare to make. And now's the time to do that for 2024. The information is available on the Medicare.gov website. But before you go to the website, for those that are thinking Medicare Advantage, I would say check with your doctors. If you have a particular doctor or doctors that you're not willing to switch, like many people with Medicare do, ask at the doctor's office which Medicare Advantage plans they participate in before going to your website to compare, for instance, the drug costs between the different plans. This will help you to narrow down your decision. And if you need help with that, or you have any questions, always remember, you could always call and speak with a HIICAP counselor. That's the main thing we're doing, is to help people compare their options in Medicare. And we're never recommending a plan or referring you for a particular choice. Okay, we're just here to explain so that you can make an informed choice about how you get your Medicare coverage.